about the nomination, and so I didn't know anything really about the nominating process. I didn't know that I was under consideration at all, so I was as surprised as everyone else was when Dr. Martin started describing a background that turned out to be my own in preparation for giving the award. It was a huge shock. I went through, I was always somebody who had very broad interests and was studying Spanish and economics as an undergrad when my mom and dad arranged for me to go see a career counselor. And this career counselor is Dr. Jeanette Nicholson. She lives in Atlanta, and she is the one, she put me through a battery of personality tests, interest inventory, interviewed me, interviewed my family, and after a very extensive process, she made the recommendation that I ought to consider being a physician, which was a surprise to me because that was very different from the school subjects I had been studying. But she said, I think that with your background, you'll be able to relate well to your patients, and then you'll be able to understand some of the non-clinical things that affect patients and their health. So if a patient doesn't have health insurance, it's much more difficult for that patient to go see the physician when she needs to go see the physician. If the technology is not well developed enough to be able to care and provide the appropriate care for the patient, that is can put the patient in a very difficult situation in that patient's moment of need. If their policies aren't in place to provide the appropriate care, or so that a patient can't get the care that he needs, that can be really, really devastating. And so she cast this vision for me really early on for what my career could look like. And then I would say from there, that was the vision I was pursuing, and there it really was kind of a one step at a time.